Hey, g'day everyone, it's Justin Flitter here. I'm the Head of Marketing for PlayBooks and I'm delighted that you've joined us for today's webinar. It's Mental Health Week here in New Zealand and a very important trigger point for conversations around mental health in the workplace. So today I'm delighted to be joined by Marshall Couper from Loffty and Greg Sheehan, who is the founder of PlayBooks. G'day guys, how are you?
Thanks, Justin.
It's lovely to be here too, with your pocket square. Looking very dapper.
I'm waiting till I've got one of those t-shirts.
Yep, that'll happen this week.
All right, g'day Marshall. How is Mental Health Week going for you guys? What's happening? Tell us all about it.
Oh, look, it's a huge week in the calendar for a company like us. It's a really important week for New Zealanders. Mental Health Awareness Week is a week that's, frankly, as the name says, it's about awareness, and true well-being starts with awareness. So it's a really important time for people to start to think about, their well-being, their mental health, particularly, in the times that we're living in with COVID. There's a lot of people that are quite susceptible at the moment to feeling a bit down and struggling, particularly in the business community. Those people, obviously, there's people who are unemployed, but there's also people who are under a lot of pressure in the business community who are lacking a bit of support, and they've got their own challenges around the business continuity around what they're doing, and they employ a lot of people, and there's an extra burden on people at the moment to not only be looking after themselves, but when you've got employees, to be looking after them as well. So it's an important time to, really, Mental Health Awareness Week couldn't have come up at a better time, as we're sort of hopefully coming out of the second lockdown, to be really starting to consider and think about, now's the time to go and get a bit of a checkup, a mental health checkup, and try and work towards getting back to how we once were.
Absolutely. So Lofty's launched this week. Congratulations.
Thank you. Thank you.
So tell us about the Loffty platform. What do you do?
Great. Look, Loffty is a multi-disorder mental health assessment solution, and it's a solution that it's not an app where you get a whole bunch of content where people go online and in the very early stages of any issues that they may be having, where they go and do a step program and improve their diet or make sure that they're doing some social things. They're great. Don't get me wrong; those sort of solutions are fantastic. But there's actually, frankly, 40,000 of them around the world. So we're more clinical than that. We actually help a person work very closely with their GP to get their GP the right information to make a proper assessment and diagnosis. So what we've had for decades, really, unfortunately, in the medical community, is we've got a medical system, a primary care medical system, that is really well tuned for physical health, because you've got these 10 to 15 minute consults, and if you go to your doctor and you've got a rash, the doctor's seen 1,000 of those rashes before and they know what it is. Or they can run some tests through blood tests, x-rays and CT scans. So physical health, 10 to 15 minutes is okay. But in a primary care or a GP environment, when often the person might only raise their mental health struggle 10 minutes into a 15-minute consult, the doctor's got such a little amount of time to ask some questions. And we know from data out of the US, out of Australia, and our own data, that more than 50% of the time, when someone has a GP consultation, they're actually not picking up on the mental health issues that are there. We also have data that says that bipolar disorder is actually misdiagnosed 68% of the time. And that's through that really time-pressed environment that a GP encounters with their patient. They really don't have the time to ask all the questions. So Lofty is all about getting someone to answer some questions before their GP consult, and the results go to the GP. So when they have that meeting, the GP's got all that information from which to make far better treatment and diagnostic decisions.
Awesome. So I imagine that, and given the fact for the last few months, actually most of this year really, we've been largely working from home and workplaces have been scattered around the place. Yeah. And that's no doubt created a lot of anxiety for different people. The whole workplace relationships change. So helping people to understand what to look for and to support their people is a really key challenge. So how would a manager or a business leader be utilizing Loffty in the workplace when they're sitting down to, I guess, raise awareness, but think about how they can be better helping their people through challenging times? Not just through COVID, but it could be through a restructure, it could be through a sale of a business, it could be a strategic shift. Any of these kind of dynamic environments create that anxiety and stress that can affect mental health, right?
Absolutely. And in fact, around June last year, the World Health Organization came out with a new diagnostic code for workplace stress. It hadn't sort of been something that was a formal sort of diagnosis before. So it's something that's certainly entering in the vocabulary of business people a bit more, is talking about well-being. The conversation around mental health and well-being has never been more open, but there's still a stigma. There's still a stigma within a workplace, particularly smaller organizations where everyone knows everyone a little bit more intimately. There's that concern of the business owner to go, how do I raise this? How do I raise this issue? But what we do know is that talking about mental health is the best way to go. And those businesses where the senior leaders are open and vulnerable and share their own mental health journeys and challenges, they're the businesses that seem to have far higher uptake of their employees into programs like employee assistance programs, for example. So EAPs, or employee assistance programs, have around about 1 to 5% uptake rate within a business, which is really low. And that's largely because the employees are concerned that if they take on that service, that their employer will know about it, and the sort of feedback that might have, or the impact that could have on their career progression. So you've got to have a solution that is very separate, and you've got that arm's length sort of transaction happening within a workplace where the employer can get the support that's maybe paid for or provided by their workplace. The employee can get that support that's paid for or provided by their workplace without their workplace knowing. Though, of course, we do encourage people to just be really open about their mental health and share it. So Loffty does that. Our solution enables a workplace employer to let their employees know it's all available, and they simply go to our website, create a Loffty assessment, and the report goes to a practitioner of their choosing, as opposed to a practitioner that's employed through an EAP type provider that is paid for by the company. So there's always that concern that something might feed back. It generally it doesn't, but there's that concern that it does, the perception that it does, but we're one further step removed as well.
Right. So you mentioned when leaders share their stories, it helps to, I guess, kind of normalize that, or it kind of beds it in as part of the culture, right? It makes it more, I guess, it makes it easier and less anxious for people to be able to share how they're feeling. So what are some of the good ways that managers can weave in conversations or bring in conversations about mental health into the day-to-day? Is it at an all-hands meeting? Is it at a one-on-one? What are the kind of ways that you're suggesting, or that would be really good for people to be able to bring that in without them being challenging or confronting, or I guess not so uncomfortable before they get to a
look, it's a really good question, and I don't think there's actually a simple answer. I think all of the above, everything from posters in your staff room, if you've got one of those, to being able to raise well-being in an open way in a one-to-one situation, or even, as you say, an all-hands-on-deck type of meeting. But what is clear, as I mentioned before, is if the senior people lead and have those conversations, then others will be more inclined to do so. Particularly if you're making it really clear in those conversations that mental health is the same as physical health. It's just, in fact, gut health, physical health, and mental health are completely related. Your exercise, your nutrition, your sleep, all of those things combine to make how you're feeling about yourself at any given time that's what it all shapes up to form that one feeling of well-being. And so it really is just important that mental health is given as much airtime as physical health within a workplace, and for people to be really clear that if they're not feeling well, they can have time off, that it's not going to impact on their career, that the management team of the organization believes that with staff who are feeling mentally well, their productivity is going to increase. So they want to let their staff know that they encourage good mental health. They encourage people to look after themselves, both mentally as well as physically, and hence why it's important for them to make Loffty, a solution like Loffty, available to their staff, where they can go and get that mental health checkup fairly regularly.
So, Greg, you're the founder of PlayBooks. I'm excited to be on the team, and I'm excited about the opportunity that we have to bring, actually it's over there, Loffty, into PlayBooks. So can you give us a little background into what PlayBooks is and what it can do, and how we bring that Loffty story and some of that mental health information into businesses?
Hey, Justin, thank you so much. Look, it is, for me, actually the honor is all mine. Having you on the team is amazing. And I know that going back, it was probably, 3 or 4 years ago, and you and I were sitting there drinking coffee in Vulcan Lane in Auckland, talking about all things cricket, oddly enough. Probably not that odd, because we both love our cricket. So to have you on the team and heading up our marketing as we launch this PlayBooks platform is just hugely exciting for me. And Marshall, I was talking to you a few months ago about Loffty and where you were taking it. And there's something really special when you meet somebody that is really driven by what they do. And it was really apparent very quickly that what you're doing, and I guess the good that you're bringing into the world is something that you hold really deeply. And I know what the startup journey is like. So to see you doing a startup that helps people with mental health awareness, and plugging all the right people together, it's pretty cool. So really cool to be able, really nice to be able to share this webinar with you. So Justin, what's PlayBooks all about? It's about exactly this, right? It's about being able to bring the world's best expertise into every meeting. And the original genesis of the idea was actually really driven out of frustration that I've had over years of trying to help small business and small business outcomes. And as we started to look into that problem, we realized that, small business owners all around the world, they have people that advise them, they have people that coach them. And I was thinking, gosh, is there a way where you can empower those advisors to be able to help those small business owners? How could they have, if you like, the playbooks for running a cafe, running a dairy farm, being an electrician, being a plumber, whatever that is? And as we started to look at that problem, and we built what is now PlayBooks, we realized actually the application was much wider. It was, how do you help anybody when they're sitting down with people they trust, whether they be their advisor or even their colleagues in a meeting? And how do you make that conversation, or we have this lovely word in New Zealand because of our Māori heritage around kōrero, how do we talk and engage with each other but get the very best out of that conversation? But as we all know, meetings can suck. I mean, they are just a time waste. Often they have loose agendas. Nobody really follows up. The actions are kind of all over the place. We felt we needed to solve that problem first with PlayBooks. A big part of what we're about is just providing people a tool to do that better. And then equally, we want to be able to bring in expertise on any topic, on any industry and in any part of the world into that meeting, whether that's a meeting between an advisor and a client or between colleagues, etc. How cool is it to be able to bring in some of the world's best expertise on that very topic at the right time? And that's what PlayBooks is all about. We also know that if we connect up people who've got the expertise, who have created and then published PlayBooks into the PlayBooks platform, that they're able to position their expertise in front of people who need help with that very service or the need to buy a product at the very time that they're talking about that issue. So we think it's pretty powerful, and we're excited by what we're doing here. It's the beginning. We launched, well, I think the 10th of this month. It's early days, but we are so excited by what we can achieve here and help people, and particularly in the world of small business.
Sure is exciting. So I'm gonna set up a little demo here because I want to show everyone out there what a playbook looks like and how you actually bring a playbook into a meeting, and specifically the playbooks that Marshall and the Loffty team have produced around mental health in the workplace. But first, Marshall, can you go through what are the types of disorders that the platform helps people with, and what are some of the assessments and reports and things like that that you're able to provide people?
Great. Thanks, Justin. And firstly, though, Greg, look, I also love what you guys are doing with playbooks. And when Justin just asked before, how's an employer raise mental health in the workplace? Well, I was coming from the now. This is how have people always done it, which is, posters, not that effective. Having conversations, of course, very effective. But playbooks actually now provides this new way with information right at your fingertips, where you've got an expert sitting with another expert, their client, and they've got this ability to actually draw on specific information on subjects like mental health, but maybe a little bit challenging for them, a bit nerve-wracking for them to raise. And now, but they're almost being coached. So looking forward to seeing how this works, Justin, in terms of the content that we'll be showing. So yeah, in terms of what we cover, Justin, the key difference between Loffty and other assessment technologies around the world is that for the last 30, 40 years, doctors have asked 10 questions, 21 questions. There's all these single disorder assessment tools for just depression or just anxiety or just postnatal depression. Maybe there's some alcohol assessments as well. But no one ever has one of those things in isolation. So you actually have comorbid mental health issues. You might have some depression with some drinking and some drug use and some anxiety and different combinations of. So we've always stood by the fact that we need to have a comprehensive overview. You don't send someone to the pathology lab and just draw blood and do one test. You run a series of tests, and it shouldn't be any different for mental health. So we cover mood disorders, so your depression, your postnatal depression, your bipolar, whole range of anxiety issues, PTSD, OCD, ADHD, panic disorder, eating disorders, 6 different major types of drug use, then some behavioral issues. So it's really extensive. And on top of that, a whole bunch of family history, past history, medication history. So really comprehensive. There's nothing more comprehensive in the world, but it's all for us. It's about comprehensive multi-disorder assessment. But really looking forward to sharing that.
And is Loffty available just in New Zealand, or is it a platform that exists internationally?
Yeah, so we actually started in Australia. It was a Kiwi doctor who started out in Perth, and he originally developed the concept because he was a GP that had a real passion for mental health, and all the other GPs who were unsure of mental health and had lacked confidence in mental health would refer their patients to him, and he realized that he was getting a lot of incorrect diagnoses. So he felt he needed to ask these comprehensive set of questions, and that's how it started about 15 years ago. So we've been operating in Australia since around about, took some time to develop it with input from Harvard and other places and psychologists and psychiatrists and GPs. And around about 2007, we really started kicking it off. And we've done thousands of assessments in Australia and now really excited to bring it to Kiwis.
Awesome. Oh, it's just so exciting. So this is Playbooks. This is our meeting that we've set up for culture and well-being in the Playbooks platform. And I've got a couple of agenda points in here. One is it's of course it's Mental Health Awareness Week, but this would apply to any time of the year. So I've got a couple of agenda points. What should we be considering to support mental health, and what are some of the symptoms of mental health issues that perhaps we should be helping our people to be able to identify? And Loffty have published a number of playbooks in the playbooks library, And so playbooks are a set of plays that make up a whole playbook. And we can go into the company library. And so I'm just going to walk you through what it looks like to add a playbook in. So this is all of the playbooks that we've currently got published in our library. And down here, there are a number of them which we've got from Loffty. So this one, Staffing and Mental Health Impacts. So these are the plays that are making up this playbook. We can click on them here. So we got what is mental health? So unpacking definition and what we're looking for in terms of mental health. And so you can we can select any number or all of these and add them into a meeting. So I'll drop them all in because we want to talk about all of them in this meeting. And I can run back to my meeting in here, and we see that these plays have now been added into the meeting. So when we're in the discussion, when we're in that moment in a meeting with our team, to be able to bring that expertise into the meeting with a couple of clicks is incredibly powerful. And we can instantly see what these are, what the content's in here. So playbooks can be informative, they can be process orientated, they can be evaluative, and we can set these up in kind of any different ways to be able to build them together. So there was that one. There is also, if we scroll back down here, another one that I saw that I really wanted to bring in here as well, which was mental health symptoms. So when we're looking at the agenda point, what are some of the signs that someone might be having some issues with their mental health? And, in here we're talking about, we've got things to look for in terms of sadness and irritability, high and low moods, changes, anything that they're, changes in the way that they're sleeping or behaving. I guess these are really great starting points and conversations or things for people to be thinking about and looking out for within their team members to, I guess, start having some conversations or discussions with people to give them the support and the help that they're going to need, right?
Yeah, look, that's fantastic, Justin. I mean, you just talked there about they're sort of starting points for conversation, and as I mentioned before, talking about mental health is the most important thing. The more we talk about it, the more it becomes destigmatized, the more people who wouldn't otherwise speak up when they're feeling challenged are now going to speak up. And with anything health-related, mental or physical health-related, getting in early and addressing issues early is the key. And so anything like a tool like this is fantastic, where you've got perhaps a manager who may not feel very confident to speak about mental health. This will help them. It'll build their confidence, but together with the person sitting there, if they're either remote and doing this across the screen like we are, or if they happen to be, putting this up onto a big screen in front of a team, for example, it can just create dialogue and create discussion around these important areas. So that's really great to see it up.
Yeah, look, I think it is really important, and I think it's fantastic that that we've got Loffty as a content partner in our library to be able to provide this rich information, and getting those conversations started is really, really key. So I'm really excited about this, and I hope that the Loffty playbooks will continue to grow, and we can continue to provide that support into growing businesses to help them look after their people and build their culture and the health and well-being of everyone, because I guess we're stronger together, and it's really important that we've got that awareness around looking out for those symptoms, but also being comfortable and confident enough to have those discussions and to talk to people as well, which is really key.
I think just the other really exciting thing about this, Justin, from my perspective, is that the fact that it's digital means that we can continually update the content. If there's any developments, or if there's an event like a COVID, for example, you can put some COVID-specific content up there. The old days, it's prints and brochures they get put on the staff, room where they have morning tea, and they soon get their way into the bin, and it ends up being a waste of time. So having a solution like this that can be used in a really timely manner is fantastic. Love it.
Yeah, absolutely. What do you think, Greg?
Marshall. Yeah, I was just going to say, look, I thank you for saying that. Look, at the end of the day, there's a lot of content online, right? There's so much online as well, but it's in all sorts of formats. It's in video. It's hidden behind, blogs on websites. There's a multitude of it. And the reality is people just don't have time to often go searching and looking for the right things. And so the big driver for us here was, how do we just serve things up in bite-sized educational format, something super simple, super digestible, they can just drop into their meeting and then discuss. And then at the end of that meeting, when they decide they need to go and do something, then ideally they can connect up with the people whose expertise they used in the meeting. And so it's just this really nice way of optimizing the meeting and ideally bringing, that expertise into that discussion. Mm-hmm. So can I just applaud you for everything that you are doing in this week, and not just this week, as Justin said earlier, mental health is not something that just happens in Mental Health Awareness Week. So really, I really want to thank you for the work that you're doing. And I know there's a lot of people across New Zealand and globally now really putting a focus on our mental health, because there's one thing that we all bring, into our daily lives, is that we're all human. There's a lot of stuff operating in the top 2 inches these days, particularly in the world we live in now. So mental health and the being able to address mental health and talk about it openly and have the solutions is just so critical for all of us. So thank you.
Yeah, you're absolutely right, and really looking forward to building on the Playbooks Loffty relationship and making sure we can get that information into hands at the right time. It's great.
Awesome. Well, thank you both very, very much for joining on this webinar and being able to share the Loffty story and how we're bringing that into the Playbooks platform during Mental Health Awareness Week and every other week of the year. So thank you very much, both of you, and thank you to all of you out there for tuning into today's Playbooks webinar. Cheers.
Thanks, Greg. Thanks, Justin. Cheers.
Thanks, guys. Bye-bye.